So in other words, if you're not vaccinated, you shouldn't have your license. So there is a real risk that these physicians not only will not be able to exercise their privileges, but they will lose their right to practice altogether. And many of the physicians who are in this position are working in private practice, and they are servicing hundreds, if not thousands, of patients. If the college decides to remove their license, then all of those patients will be without these physicians. And most of the physicians that I'm involved with are specialists. And so it's not that they can just go to a walk-in or something. They will lose access to these doctors, which will put more pressure on our already very strained healthcare system.
Despite hospital shortages that are plaguing British Columbia's hospitals, the province of BC is still hanging on to vaccine mandates preventing thousands of healthcares from working, but that is not it. Their health authorities are now coming after unvaccinated doctors, trying to remove their privileges so that if vaccine mandates drop, they still won't be able to help save British Columbians' lives in hospitals. Drea Humphrey here with Rebel News. And if you haven't already seen my report, my interview with Dr. Chris McCollister, one of the newest clients for the Democracy Fund charity, you have to watch it. Dr. McCollister is one of two pediatricians who not only is subject to BC's draconian health orders that prevent hospital workers, including pediatricians like himself, from helping to save lives, children's lives in hospitals, but now he is under attack by health authorities. What do I mean by under attack? Well, basically, they have come together to remove his privileges. That means even if Dr. Henry drops her draconian orders preventing him from being in the hospital, he still won't be able to go because he won't have his privileges. And they'll also, the man I'm about to interview today, the man with the plan, his name is Mr. Lee Turner. The council that the Democracy Fund has hired to take on this important fight to appeal that decision says that this could very well likely lead to doctors like Dr. McCollister losing their licenses altogether, but not on our watch. That's why we created a special website called SaveTheDoctors.ca. If you head there, if you go on a device, please donate what you can, replace your coffee, whatever it is. This is going to be a lengthy battle. But imagine a province in Canada that finds a backdoor way to eliminate physicians who are unvaccinated from caring from you. Will that spread across the whole country? I don't want to find out. So please go to SaveTheDoctors.ca to chip in to help cover the legal expenses for this very important case. When you go to SaveTheDoctors.ca, we've made it very easy for you to also send an instant email showing that you want this punishment on unvaccinated doctors to end now. So again, that is SaveTheDoctors.ca. And here's Lee Turner.
Right, joining us is Kelowna-based lawyer, normally a personal injury lawyer, now on to the freedom legal fight. This is Lee Turner. Thank you so much for being on Rebel News today.
Thank you for having me, Drea.
Now, before we dive into this very important case that you're working on, I want to know a little bit more about how or why you transitioned into taking certain cases that do involve the fight for medical freedoms in Canada.
Well, as part of my personal injury practice, I get to work with a lot of medical professionals. So I've gotten to know a lot of physicians and nurses through my practice. And when the mandate started coming down, I started getting an awful lot of phone calls, initially from nurses that were concerned about their rights and what they could do to, exercise their right to make their own choices about their medical treatment. So that's how I got involved initially, was looking at the mandates and helping some of the nurses understand what their rights were.
Well, that sounds very similar to how I have been doing many reports. It's kind of started with the nurses. They seemed at the front lines of everything when it came to who was letting us know at Rebel News, sort of the other side of the story with COVID-19 and restrictions. And then, of course, who took a big brunt when it came to mandates against the healthcare industry, which brings me also to why you and I are doing this very important interview today. Our charity partners at the Democracy Fund have hired you to take on the fight for your client, which is Dr. Chris McCollister. Now, I already have a full report with his story up. So you guys, if you're watching that, you can catch the details of that in the description box below. We linked in this report. But I wanted to meet with you today to talk a little bit more about the legal fight to that, and also so you could explain to the people watching how hard it is for these doctors or people in their situation who kind of want to pursue maybe holding the government accountable for some of the policies that are coming down and how they are affecting their industry and their careers. So let's start with explaining the first step that you have taken, or you guys have taken, for this legal fight.
Okay, well, maybe I should just give the context of how it all started.
Sure.
Of course, as we know, the public health orders started coming out last fall, and there was a number of iterations of this particular order, but the one that was in place up until Monday earlier this week was a November 18th order that prevented physicians and others from working in a facility like a hospital or a care facility unless they had received the COVID injection.
So if people are in our healthcare system and not recognizing the importance of vaccination, then this is probably not the right profession for them, to be frank.
And there was deadlines for the first injection and the second injection. And so if the physician, in this case of Dr. McCollister, had not had the injection by the certain date, they were no longer permitted to exercise their hospital privileges, for example. But the order made it quite clear that these healthcare providers had, three choices they could make theoretically. In reality, I think there's really only two. One is you get the injections by the deadlines and you continue to exercise your privileges. Second one would be to get an exemption, which, as we know, is really a deferral and which is very hard to obtain. So I don't really see that as a realistic option for most people. Mm-hmm. And the third one was to, exercise your choice not to receive the injection and not exercise your privileges while the order was in place.
Right.
So Dr. McCollister is one of those physicians that chose, for his own reasons, not to have the injection. So he continued to work in his private practice, but not exercise his facility privileges. Mm-hmm. And now, so that's where the public health order takes us to. Then what's happened is the health authorities, and this is true of all of the health authorities in British Columbia, not just the one that Dr. McCollister works in Vancouver Island Health, but the health authority has decided, and it started with the president and CEO of each health authority, essentially writing a letter to the physicians saying, because you have chosen choice number 2, I will call it, mm-hmm. we're going to recommend to the advisory committee, the medical advisory committee, that we cancel your privileges, that we discipline you. And if the medical advisory committee accepts my recommendation, then that will go to the board of directors for decision. If the board agrees, your privileges will be canceled. That is a disciplinary action, yes. which is very serious for a physician. There is other judges in different cases in Canada have said it's a professional death sentence to have your privileges canceled. Now, if that happens, the doctor's recourse is to appeal to the hospital appeal board. Mm-hmm. And then from there, if they are unsatisfied with the result, they have the option of bringing a judicial review application to the Supreme Court of BC.
Right.
So that is kind of the process. And as we've gone through it over the last several months, it has evolved. Initially, the allegations from the president and CEO and even the health authority medical advisory committees, we call them HAMMOC often, their recommendation was suggesting that the physicians were in violation of the public health order. When I was brought in to assist with this, we pointed out to the health authority that actually is not true. These mm-hmm. physicians are in full compliance with the order. They've since agreed with that and admitted they made an error when they started this process of trying to cancel the privileges of all these physicians. So now they admit that the physicians are in complete compliance with the public health order.
Well, that sounds like good news.
Well, you would think that would be good news, but they've indicated that although they recognize that they have the legal obligation to respect the doctor's choice around medical treatment, that the doctor can refuse medical treatment for any reason and has the right to have that choice respected. They say they acknowledge that.
Right.
We respect your choice, but because you didn't choose what we wanted you to, we're going to discipline you and we're going to take the harshest punishment that is available to us, and that is canceling your privileges.
Yeah.
Now, in order to do that, if I can just one step further, in order to meet that test, if you will, under the bylaws that govern these physicians and their relationship with the health authority, they have to show that the physician has refused or neglected to fulfill their privileges.
Right.
But the health authorities have also admitted that these physicians are prevented from fulfilling those duties because they've chosen not to be vaccinated. So to try to simplify that, the argument goes, yes, you're in compliance with the order. We acknowledge that.
Mm-hmm.
Yes, we acknowledge you are being prevented from fulfilling your privileges. Yes, we acknowledge we have to show that you are refusing to fulfill those privileges in order to discipline you. We say because you did not choose option number one and get vaccinated, that it is equivalent to refusing and neglecting to fulfill your duties. And therefore,
Wow.
yes. And so now these physicians, you talk about the process they have to go through. So they were often given letters reminding of these deadlines or emails. Then the CEO writes a letter saying we're going to recommend cancellation. Then it goes to the HAMMOck committee. Some health authorities allowed the physicians to speak to the HAMMOck. Some did not. And so the HAMMOck then looked at it. They've made their decision. Yes, we agree. Goes to the board. And then the board has agreed. And what I've found in all 5 health authorities is the process has been the same. The arguments have been the same. The documents are the same. There does not appear to be any consideration of these individual circumstances of each physician, because some of them work in a facility where they are one of 5 people and there's maybe 2 vacancies and there's 3 people filling the role for 5. Others, there's just different circumstances for each of them, but it appears that the same approach has been applied to them all regardless of their circumstances. And once the board agrees with this recommendation to discipline the doctor and cancel their privileges, that must be sent to the College of Physicians and Surgeons of BC. And it is a serious matter. And our Minister of Health, Mr. Adrian Dix, was indicating on television in the fall that he was working very hard with the colleges to make vaccination a condition of licensure.
This is critical for the provision of healthcare services. I think it's as important for family doctors and for dentists and for people working in the community to be vaccinated. The vast majority of them are, I think, of doctors, 98, 99%. But you'll expect that very soon. That work is being done through the colleges. So this will be a condition of license for people.
So in other words, if you're not vaccinated, you shouldn't have your license. So there is a real risk that these physicians not only will not be able to exercise their privileges, but they will lose their right to practice altogether. And many of the physicians who are in this position are working in private practice, and they are servicing hundreds, if not thousands of patients. If the college decides to remove their license, then all of those patients will be without these physicians. And most of the physicians that I'm involved with are specialists. And so it's not that they can just go to a walk-in or something. They will lose access to these doctors, which will put more pressure on our already very strained healthcare system. So that's basically it in a nutshell. I can...
I'm just trying not to pull my hair out when I'm listening to you. I mean, there's so many things that seem so wrong with this. I call it a level of overreach in so many ways. But I mean, British Columbia is a province that is struggling to have family doctors. We're struggling to have enough as it is. Dr. McCollister is certainly not the only doctor in this situation, but this fight is so important because what happens to him can set precedent for the others. So if you guys, again, if you want to get behind that, please donate what you can at savethedoctors.ca. But I bring him up because he's the perfect example about how egregious this situation is, because, correct me if I'm wrong, he's one of 2 doctors in his field in a small region. And you told me something very interesting, is sort of what they were saying is the reasons why they may have to sort of let him go for not having the vaccine, and how they haven't been able to fill another position. I'm probably butchering it in the way I'm saying it, but can you go through the reasons why they're saying they want to take this path of removing privileges from doctors like Dr. McCollister?
Yes. So the first level of this is what I've explained in terms of the health authority having to prove that the physician is violating the bylaws by refusing or neglecting to fulfill their duties. Obviously, we take the position that that is not what's happening here. They're being prevented. They've made a legal choice. Once that, if we assume the health authority is correct and being prevented is the same as refusing, if we assume that to be the case, then the next level of the inquiry is the health authority, the board, exercises its discretion. All right. So in light of the violation, we have a number of options open to us. We can do nothing. We can suspend the privileges. We can restrict them, or we can cancel them. So how should we exercise that discretion? Well, the health authority's position has been essentially two main arguments that they make. One is we cannot recruit other physicians to this position while you maintain your privileges, because we say that other doctors will not be interested in the position because they'll be concerned that maybe if Dr. Henry removes this order or it gets removed, that physician could come back to work and they would displace the physician who had come in to assist. Mm-hmm. But the reality is most of the positions, and like Dr. McCollister, they're understaffed. They have been for a decade or more. They've been recruiting throughout that time without any success. And so we would take the position that, first of all, we would want you to provide some specific evidence, which they have not done in any of the health authorities. They just make the bald assertion that we can't recruit unless we cancel privileges. But if you think of Dr. McCollister's situation, if they have one person working when they really need three, because they did have three for a while and they've been down to two for quite some time, as I understand it, they could use three. So if the argument is, well, if we replace Dr. McCollister, that brings us back up to two. We still need one.
Yeah.
We haven't been able to find that one in 10, 15 years. So wouldn't it be nice if the order is rescinded at some point and now we actually have a full complement of physicians? But when we've asked for that evidence, it doesn't come. And in fact, in one of the board hearings I did, the board even asked for the information and it was not provided, but the board still endorsed the recommendation. So that's argument number one. Argument number two is that in addition to the recruiting issue, there is the issue of equality or consistency of approach. So they're saying that because we have fired other people in the health authority for not being vaccinated, then to be consistent, we need to do the same to you essentially by canceling your privileges. That will make it equal and consistent. Our position is, of course, that a physician holds a unique relationship with the health authority. They're not an employee. They're not even a contractor per se. They have a unique relationship. Mm-hmm. And you cannot compare them to another employee that works in, say, administration, for example, who has a private contract. They have their own terms with the health authority. Similarly with nurses, for instance, who might be part of a collective agreement. They have their own arrangement with the health authority. And we have at least two decisions from arbitrators in British Columbia where they've looked at cases involving nurses who were fired for not getting the vaccine. One arbitrator found it was reasonable based on the wording of that collective agreement. The other arbitrator in the other case said for that particular nurse, it wasn't reasonable based on that wording. So we've tried to say, if you want to be consistent, you should treat all the physicians the same. So the physicians who are vaccinated, have been able to maintain their privileges. Mm-hmm. If you want to be consistent and equal, allow the unvaccinated to also maintain their privileges. Doesn't mean they can exercise them right now, but there's no reason to cancel them, right? They've been abiding by the health order, and the health authorities admit that. There's no allegations of professional misconduct, no allegations of incompetence, and they agree that these physicians are following the health order. So then why, if you want to be consistent and you want to have equality, why wouldn't you treat them the same? One other thing that I think is important is that one of the physicians that was found himself in this position did an FOI request of the government and asked the government if there was any evidence they had to suggest that an unvaccinated physician was at any greater risk of infection or transmission of the virus compared to their vaccinated colleagues. And the government confirmed that they had no evidence to suggest that. So if we're, again, talking equality, so there's no evidence there's any difference in infection transmission, why wouldn't you allow both groups to maintain their privileges? And that's kind of where we're at right now. And we're about to go to the hospital appeal board. And we have a meeting next Friday to discuss some preliminary issues and procedure. and the hearing hasn't yet been scheduled. So
I just want to throw in there, the contrast is so crazy. In British Columbia, we're seeing babies dying because they're not getting the care. There's a shortage in staff in healthcare. And then you have Danish Health saying, you know what? The vaccination isn't really needed for people under 50, so we're not going to be offering it to them unless they, have a compromised immune system. I mean, the contrast between basically telling doctors that if you don't get this vaccine, you won't be able to work in hospitals, and you might ultimately lose your license, is just mind-boggling to me. But please do explain to those who are watching the process of who's at each tier when you're trying to say, hey, what's happening isn't fair. Who's at the head of that, and how are they all in their positions?
All right. So the hierarchy of decision making here for a physician who wants to challenge the health authority's position is this. As I mentioned, this whole process started with the president and CEO who made this recommendation. So the board of directors, who ultimately can make the decision to discipline the physician, is appointed by the Minister of Health. All right, or the Minister of Health has the right to appoint the members of the board.
Mr. Adrian Dix.
Yes, in this case. And I don't know, the tenure is 2 years, up to 2 years. So I presume the members that are there now were probably appointed by Mr. Dix, because it's been much longer that he's been in his position. So the board of directors then employs the CEO and president. And the CEO and president then appoints the vice president of medicine. So those are kind of the folks in the decision-making role. The HAMMOC, or the Health Authority Medical Advisory Committee, is appointed by the board. So again, we have Minister of Health appoints the board appoints the committee, and the board appoints the president appoints the VP. Now, if you don't like that whole process, those first two levels, HAMMOC and the board, and you go to the Hospital Appeal Board, again, the Minister of Health appoints those representatives to that board.
The tentacles are so deep.
It's deep. And then to go to the Supreme Court, where we get to be in front of an independent judge, a legally trained judge, even there are restraints beyond sort of what normal litigants would be able to address in the courtroom, in the sense that it is a judicial review. And that means that there's a higher standard that the complainant has to meet to change the decision. Mm-hmm. You have to show that it's not reasonable, as opposed to, the court being able to look at whether the decision was correct or not. It's more, was it reasonable? In other words, if someone could find that, even though I might disagree, we're not going to disturb the finding. The other challenge for complainants in the judicial review system is you're limited to the record. So the record that is before the Hospital Appeal Board. And if new important information comes out, there are limited exceptions to be able to get that information before the court. Mm-hmm. And as we saw in a decision from Chief Justice Hinkson that came out on Monday, there was an important, I think, affidavit from an expert witness that the court felt it could not consider because it was not part of the record. Mm-hmm. And so it can be challenging to get that fresh evidence or new evidence in. So for all those reasons, it's an exhausting, long, expensive battle for anyone that has to participate in it, like Dr. McCollister. And these physicians have been, for most of them, had a significant decrease in their income since October, and in some cases, a complete elimination of their income since that time. And so in that environment, they're then being asked to go to 3-4 levels of adjudication to try to get this matter resolved, which is why we're grateful for the Canadian Democracy Fund, because without groups like that, a lot of these people would not be able to defend themselves.
Yeah, grateful to our viewers who are watching. You guys are the backbone of that charity. So for those who are watching and are considering whether or not they want to donate for this fight by going to savethedoctors.ca, just explain to the viewers and Canadians in general why this particular fight matters so much for British Columbians.
Well, as we've talked about, we have such a shortage of doctors in this province, and the physicians that I'm working with are very well thought of by their peers. In fact, in all of the hearings that I've been in, the VP of medicine often comments on how much they appreciate this physician and how well thought of they are. They're often at the top of their group. So these are key physicians. And as I mentioned, if their privileges are canceled, there is a reasonable likelihood that their licenses will be canceled. So we will lose these physicians. So if and when the current health order, which is now the September 12th, 2022 order, if that is ever rescinded or set aside, these physicians, if they're still in the province, no longer have privileges. They need to reapply. And the government can put whatever criteria they want as a new applicant on that rights to have privileges. Plus, it takes time. So we're in urgent need of physicians now. Even if the order was to be rescinded next week, it could take several months before these physicians would get their approvals in place again before they could actually return to hospital. So some of the group that I've been working with, they have dropped out, they have given up, they have retired. Some have moved to other provinces, some have moved to the United States. So we're losing these doctors, and once they're gone, they're gone. And that's why it's so important that we can't just wait. There's a number of other very important cases going before the court to deal with the public health order. And if they're successful, if these physicians have their privileges canceled and or their licenses, they won't be there to assist. So that's why we can't just wait for those other things. And I do want to be clear, too, that in this particular case, we are not attacking the public health order at all. That's not what this is about. This is about in the context of a physician who's obeying the order and is prevented from filling this, should they have their privileges canceled? That's what we're dealing with. So, I mean, at times we've been accused by the health authority of trying to attack the health order, which they have no say over, and that is true. They do not. We're not attacking that here. That's for other cases that are going on elsewhere. But we just think it's unreasonable and really counterproductive to your primary purpose to ensure you have adequate physicians and healthcare people around to service the patient population. It's counterproductive to remove them from the game. Why remove them? They're already abiding. A lot of them are working very hard in private practice and helping the health authority in that way, so people aren't going to the emergency room instead, for instance. They're actually able to go and see a physician in their office. So canceling them, and if they lose their license, now you've just flooded the emergency department or the existing doctors who are already overwhelmed with all those additional patients.
And that was the whole narrative, was that all of this was in place so as not to overflow our hospitals. Well, it's been a pleasure talking to you. I could pick your brain for a very long time. I'm sure we will see you again, as I will be updating the public on this matter and the steps that you guys are taking for this fight for Dr. McCollister, which is also representative of other doctors in British Columbia. And if this happens to him, I don't see it stopping for other doctors across Canada. So thank you so much for being on here at Rebel News. We'll keep in touch.
My pleasure, Drea. Thanks for having me.
Thanks.
I've said it before and I'll say it again. This medical madness must stop. Go to savethedoctors.ca.